Rising rates of dementia are set to drive a massive shortfall in aged care places over the next 40 years. A new report warns that Australia is facing a shortage of 280,000 places by 2050.
Ageing baby boomers and the growth in the number of people with dementia is already putting the squeeze on aged care places.
The dementia explosion, the epidemic, is on us. We need urgent federal action to provide for that right now.
The report launched today by Alzheimer's Australia at a fundraising lunch found that by the middle of the century, more than 95,000 people in the country's most populous state may not have access to aged care services. 72,000 could miss out in Victoria and 50,000 in Queensland. A breakdown of federal electorates shows Paterson, north of Newcastle, will fare the worst, followed by Mayo in South Australia. Some aged care providers have already made dementia care a priority.
Well, at the moment, we have about 2,500 people with a diagnosis of dementia in our care every day.
Siblings Sarah and James Murdoch are worried about finding age-appropriate care for their 60-year-old father.
Aged care services are offered to people over the age of 65, so there's quite a large black hole at the moment for the people with younger onset dementia.
Last month, a Productivity Commission draft report proposed a major overhaul of Australia's aged care system, but none of its recommendations dealt with dementia. Today, the high-profile son of a dementia sufferer challenged the federal government to do more.
But the ultimate must be a cure, and we know the only way around that is money.
Without a significant medical breakthrough, the number of Australians with dementia will grow to almost 1 million by 2050. Rebecca Barrett, ABC News.